running a ton of education through. We are so excited for this next talk. We've got Dr. Patrick Mahaney with us. You guys, a friend of Basepaws. I've had the pleasure of speaking with him before on our Cats and Coffee, so you might be familiar to some of you guys already. We have a really engaged, really fun group here today, Dr. Patrick. These guys are, there's the best of the best cat owners. And so get ready for great questions, great engagement. These guys are so excited to talk to you. I think you're really addressing an important topic, especially just with these times of COVID. In-home veterinary care for so many reasons is important, but in this time, so I'm going to let you take it away, Dr. Mahaney, the founder of California Pet Acupuncture and Wellness Inc. You guys, he knows what he's talking about. He speaks, he writes, and now he has got a concierge style, very lovely. Wish he worked in North Carolina, home call service, making sure pets and people are really just getting the best care they can. So you guys, Dr. Patrick.
Thanks. Okay, I'm gonna move to the next step of trying to share my screen and get my presentation up. This is all a little new and evolving, our technology. Okay, presentation starting. Just have to move this poll out of the way because it's blocking my view. Sorry. Okay, go away poll for now. Okay.
You can just close that box, no problem, Dr. Mahaney. You can just pull it up whenever.
Okay. Yeah, I remember to pull up. I'm gonna have to exit my screen to pull it up though. That's kind of the challenge. Bear with us for a moment, folks. Let me just get this up here where I can see it when I need it. Okay. All right, so let's get going. Well, here's my presentation, House Call Veterinary Practice Before, During, and hopefully after the COVID pandemic. With me, well, introduction to me and what I do and where I've been. I went to school at University of Delaware. That was my undergrad way back in 1995. It seems like a lifetime ago. I guess technically it is a lifetime ago, but that was a great experience. I learned a lot, gave me all the prerequisites I needed to then go on to veterinary school. I went to University of Pennsylvania, finished another lifetime ago way back in 1999. My plan was to be a veterinary radiologist, so I wanted to do an intern. I had to do an internship actually to be able to do a radiology residency or really any residency in veterinary medicine, unless you're kind of grandfathered in through clinical practice and have done other things. So I moved to Washington, D.C. to do my private practice internship. I planned on leaving for my residency right afterwards, but it didn't quite work out. So I stayed in the Washington, D.C. area. Briefly worked with somebody else who's involved with this event, Ellen Carroza, one of the best veterinary technicians I've ever worked with. Ellen, would you like to move to LA and work with me as a technician? I would love that. Anyway, I wanted to get out of the DC area after 9/11. And so I moved to Washington State and then I moved to Southern California. As I was moving from Washington to Southern California, I was going through veterinary acupuncture training. I've always been an advocate of healthy lifestyle and kind of complementary and alternative practices for my own body. I've got arthritis and intervertebral disc disease, so I've sought out chiropractic acupuncture. I do yoga quite a bit as well. I used to be a teacher. So I got a acupuncture certificate through IVIS and then kind of right away started to put it into veterinary practice. Also moving to LA, it's like the land of media. Never before would I imagine I would like when I first moved to LA, I was working at a West Hollywood practice and I would walk in the door sometimes and there would be some celebrity there that I knew of and they were maybe under an assumed name or something. So I'm kind of thrust into this entertainment world living in Los Angeles. And it's even more interesting now that I'm a house call veterinarian because I work with a lot of entertainment people in their homes. So in order to be able to do more as a journalist, I got a certified veterinary journalist certificate from the Veterinary News Network in 2013. So wanting to be a radiologist, I wanted to have my own radiology practice, going to hospitals, doing ultrasounds, interpreting CTs and MRIs, but that didn't quite work out. So when I moved to LA, I still had that entrepreneurial urge and I figured I can have my own house call practice. So I created California Pet Acupuncture and Wellness, where initially I was just providing acupuncture, Chinese herbs, Chinese medicine, nutritional consultations to clients on a house call basis. And that has evolved quite a bit. Sometimes I see patients in my own home. We'll get to that a little bit later as well. These are two patients of mine, Rossi and Maggie. I also work part-time at the Veterinary Cancer Group. I'm not really doing that as much right now because of COVID. I don't want to put myself in a facility around other people where I don't really know what they're doing with their off time. And my practice is so busy that I have to just kind of prioritize it the most. But at Veterinary Cancer Group, I provide a complementary and alternative approach to cancer treatment. I work in conjunction with the medical and radiation oncologists to complement the chemotherapy and the radiation with herbs, whole food diets, acupuncture supplements, etc. Here I am with one of my patients, Norbert, that some of you must be familiar with. Norbert would come to see me once a month for an Adequan injection. Now I'm going to his house. He is like a tough little sturdy dog for a 3.5-pound dog. And he's actually one of the most followed dogs on social media, almost 1 million Instagram followers. In 2020, I became Chief Veterinary Officer and part owner of Pure Dog Food, having always wanted to pursue a healthy eating style for myself and apply that to my patients. I was able to develop this partnership with Pure. They make a cooked whole food product. It's organic, but for the vitamin mineral mix. Right now, it's just canine recipes, but we're working on some feline recipes as well. It's driver delivered or FedEx shipped to clients' homes. It's also sold at some human and pet retailers like Erewhon, which is like a nicer Whole Foods. It's kind of LA specific, but also Healthy Spot, Vanderpump Dogs. Vanderpump is Lisa Vanderpump from the Real Housewives of Beverly Hills. Here I am with Pure Dog Food founder Lindsay Gores in the middle, and her husband Ali Amadi run the show. And we're in Erewhon at this point. This is like right after I signed my contract. So I love like having a role helping to influence what dog owners and hopefully cat owners soon are feeding their pets, because I really feel like cooked whole food diets are the way to go. I've seen it time and time again benefit my canine and feline patients. For you cat lovers, we have those 2 recipes in development, a poultry and a seafood one, most likely chicken and salmon, possibly a whitefish. We're still working on it. But right now we've got delicious chicken and parsley treats, which are just air dehydrated, low heat cooked chicken. It's actually kind of like the leftovers from what isn't used in the chicken recipes for dogs. It's not a byproduct per se, but it's just what isn't leftover. And these are delicious. I actually eat them myself sometimes in front of owners to show them what you should be willing to put your pet's food and treats into your mouth. And if you think it's too gross to do so, then maybe you're doing a disservice to your pet. I have a couple like palate cleanser slides as I go through this presentation. There's things that I find amusing. I found this kind of amusing, particularly to the cat world, because in the grocery store out in Palm Springs, which is like 2 hours from LA, and I see the aisle of canned cat and dry cat. I'm like, is it canned cat food and dry cat food, or is that where you find a dry cat and a canned cat? Anyway, moving on. So today's goals are to understand what it's like to work as a holistic house call veterinarian serving Los Angeles clients is what I do. Basically 7 days a week. I try not to book appointments on the weekend so I can catch up and have a bit of a life. Also to learn how my house call practice has changed as a result of COVID-19. To become familiar with some of the precautions that I take while working with cats in their homes and other pets too, of course, during the era of COVID-19. And to experience some of the stories of some of my feline and canine house call patients. I've had some interesting patients over the years that have been very interesting kind of technical challenges in order to try to get them better. So I started my house call practice in 2008. I actually had an aha moment. I have a little video here. Here I am walking my now deceased dog Cardiff through the hills. I'm right off of Mulholland Drive. This is in an area called Fryman Canyon. It's a great hiking place in LA. And I was driving Cardiff around to go to dog parks and on hikes, and I would see mobile groomers, mobile dog walkers, mobile veterinarians, and I figured I should have my own mobile acupuncture practice. I didn't know anybody else that was doing it at the time. It was 2008. And so I had my boss at the time, who was a lawyer, and helped me to incorporate myself so I can kind of have that separate structure for running my business. And I just started seeing patients, and it just grew and grew and grew. And I needed to add additional services like diagnostic testing. I do lots of blood, urine, fecal testing, dispensing medication, supplements, et cetera. And it just has really become this thing that I almost sometimes feel like, how am I going to end it? Because there are people that I've gotten to know for so long. And when I want to retire in maybe like 8 years, I'm 47 now, I'm hoping to retire when I'm maybe 55. I'm going to have to back off a little bit and keep some people, but it's going to be hard to kind of step away from that. So it's a little bit overwhelming at times, because I'm like, I have to kind of do everything, but it's also extremely rewarding because I get to do exactly what I want and work with amazing people and people who really appreciate their pets and want services on a house call basis and are able to pay an appropriate amount for it. So here's some of the services that I offer in my house call practice. I really do a whole holistic health consultation, and that involves collecting medical records and doing a very thorough pre-consultation review. Sometimes I'm poring over years and years of medical records, and these are not simple cases. These are complicated mobility problems, endocrine problems, cancer problems. And so it's a long process just getting all that info, assimilating it, figuring out the trends of illness, but I actually really love that. That's all part of the puzzle process of really working a case up. performing a physical examination, of course, which I actually do from both the Chinese medicine and the Western or conventional perspective. Chinese medicine perspective really closely looks at the tongue, feels the pulses, characterizes the pulses. It's a little different from the Western physical exam. I also definitely look at the pet's environment and their lifestyle. As compared to when the pet comes into the hospital, there's so much more that you can learn about what's going on and potentially injuring or sickening the pet and what happens at home. You can't see everything all the time when they're just bringing the pet in for their 15-minute appointment. And actually my consultations, my initial consult with clients is 2 hours. It's a lot of reviewing that medical history, figuring out what's going on now. And it's really, I love to have that opportunity to really take my time, give the client enough time as well, because nobody wants to be rushed to an appointment. A big part of what I do is dietary modification. For example, I take a patient on, I figure out what their current weight is and their body condition and their muscle condition score, and I decide a more desirable weight for them, either gaining, maintaining, or losing, and you adjust the calories. So you figure out the resting energy requirement, RER. You then determine how many more calories they need to eat based on if they're growing or if they're spayed or neutered, or if they're extremely lazy or something like that, or if they need to lose weight. And then you have a number, and then you get to look at the food and the treats, and you have to kind of come up with a formula as to what the pet can eat. And I actually really find that process interesting, and actually seeing the results as we try to get them to gain weight if they're not eating enough, or get them to lose weight if they're too big. And then I either dispense or I kind of arrange for medications. I carry a lot of different products like anti-parasitic products, herbs, supplements, metronidazole, antibiotics, anti-inflammatories. But sometimes I need to work with local compounding pharmacies like Nick's Lab, which is LA and New York based. I love them. So I want to be able to like get medications to my clients very quickly. Sometimes I'm doing it, sometimes I'm arranging for it. Also, after this is part of like what sometimes just exhausts me is that when I take on a patient and I see the patient afterwards, I do a post-consultation email summary. That's like a report card, and that is what is going on with your pet, the diagnostic testing, the interpretation, the medications, the supplements, the feeding, the microchip scan, the next steps, and I put it all in an email and I send it to them, and I hope that they read it because that's the next plan of what we need to do. And that's kind of how I offer this kind of concierge style approach, where it's very specific to the patient and to the client. It's not like one size fits all. And a lot of what really kind of makes why I say concierge, I don't do a monthly retainer. I just am available when they need me within certain constraints, of course. They text me, they phone, they email me. I try to get people to email with non-urgencies and to text and phone with urgencies. And of course, I turn my phone off at 10-ish at night because I have to be able to go to sleep, and I have an outgoing message saying, call here if you have a problem. Also, I work with so many specialists as well. Most of my clients have the means of being able to pursue specialty care, ophthalmology, oncology, internal medicine, surgery, neurology, dentistry, dermatology, et cetera. So I'm helping to coordinate that care. Sometimes I'm making the appointments. I always have to do the follow-up, and sometimes I'm translating for the client what the internal medicine specialist has done so that the client better understands. And also say my patient has an emergency and it's not something that's appropriate for me to go to the home to address, or I'm physically unable to go, like I'm out of town, then I help to coordinate them going to emergency practice and doing the follow-up afterwards as well. So I also work as a client and patient advocate for my clients and patients. I sometimes go into facilities and I'm there on behalf of the client and the patient. I'm able to provide the patient with some comfort. And also I can communicate with the client as to what is happening at the time. Here's a feline patient of mine. Unfortunately, she's no longer with us. This is Sophia the cat. Sophia actually has two actor parents, and my husband Phil and I moved into the client's home for 2.5 months while they were off shooting all sorts of places. So I got to know Sophia very well. And right when I was moving into the home, this is in 2015, she started to get sicker from inflammatory bowel disease and chronic kidney disease. So I would take Sophia into the internal medicine specialist for her ultrasound and do whatever she needed to have done. And I've had other patients too. Like I have this one client who nothing is ever not possible in their mind. And so when their dog had cancer and also needed surgery, I would have to go into the surgery on behalf of the client. And every time he needed an ultrasound, I would have to bring him in so I could be there to hold him, because kind of the owner didn't trust anybody else to do it. And I had a very good relationship with the specialty practice that let me do it. So I have that kind of client-patient advocacy part of my practice. Do lots of laboratory testing, as mentioned before, definitely blood chemistry, CBC, thyroid testing, infectious disease panels, vaccine antibody titers. I'm a big believer in titering if possible, instead of just giving that vaccine because the due date has come, especially for cats. I mean, in cats, California has no legal requirements for vaccination. It's strongly recommended that we give rabies. So I do try to practice that, to give my feline patients rabies at least once or twice, and then maybe we consider blood testing, because cats don't have that legal requirement. Dogs, it's a little bit different. But having had a dog that had chronic, generally fatal immune system problems, immune-mediated hemolytic anemia or IMHA, I knew I shouldn't just pump his body with immunostimulants that could cause his immune system to turn on itself. So I apply that to all my patients, especially cancer patients. Also love to look at urine. Urine is so interesting, especially when you have a patient that has chronic kidney disease or acute kidney disease. So lots of urinalysis, ideally first caught in the morning, because that's the best representation of how well the kidneys are concentrating. I do urine culture and MIC susceptibility, so we know if there's bacteria there, what is it, how many hundreds of organisms per volume, and also what type of bacteria, and also what antibiotics are they sensitive to. And also I've been doing lots of urine protein creatinine ratios as of late, because if you have protein in your urine, you have to start figuring out, is it a one-time thing? Is it happening at a different time of day? So you have to do 3 of these tests over about 2 weeks to figure out what's going on. And then I get my internal medicine people on board to help me out. Lots and lots of poop testing. I've had tons of new puppy patients as of late, definitely more new puppies and kittens, but some new cats as well. So ovo and parasite ultracentrifugation for microscopic evaluation of parasites in eggs. Love doing antigen testing, yet sometimes it like opens up a whole can of worms, so to speak, because the patient may be clinically fine, but you're getting a positive antigen test. And so you have to figure out, do you treat or do you not treat? And then PCR testing is super interesting as well, especially if you're looking for more unusual causes like Salmonella, Cryptosporidium, Campylobacter. Clostridia is a big soil-borne bacteria that gets into patients' bodies, especially dogs that eat soil, and it can really kind of ravage their inside. So I do lots of PCR testing. And then cytology. I love looking under the microscope myself. I will do in-house skin impression smears, ear cytologies. If I'm going to aspirate anything, I'm pretty much sending it out, because I want to like make sure that I get the pathologist interpretation, not just my less than fully trained eyes. And then other testing, of course. I coordinate for X-rays, ultrasound, CT, MRI with area hospitals. I partner with them, and it's great. Like most veterinarians just really want to work together, because we all in the same business. We need each other's help in certain realms, and so I love having these partnerships with specialty hospitals. Here's an X-ray image of one of my patients, Tulip, and if you look very closely, this might be more of a veterinarian thing, but I think it might be interesting for people as well to see, even you're not a vet or in the veterinary, the field of veterinary practice. So this is a patient, and this is why it's always very important to like look at your normal or understand your normal so you can look at abnormal. This is a patient, she's like a 9-year-old labradoodle, miniature labradoodle that had chronic problems with her appetite and just kind of seeming off. And she was chronically treated for digestive problems, but the whole problem ended up not being digested and it being musculoskeletal, because she has 8 lumbar vertebrae. There's 8 if you count for the first one, which is just where the ribs end, ending just in front of the pelvis, and actually was causing pain in her spine. And so we did acupuncture, laser treatment, got her on supplements and herbs, and now she's totally clinically fine. So this owner was getting the answer all along, like it's digestive, it's pancreatitis, it's ileus or something like that. And it really actually was all musculoskeletal. And that's why like you have to really do a thorough workup and keep on looking and looking and looking and communicating with your clients too, because they're going to tell you what's going on. I do a lot of acupuncture in my practice, probably a little bit less now that I'm more along in my career, because acupuncture is very time consuming and physically taxing, because you're kind of hunching and corralling, and I've got back problems. So I'm trying to do it a little bit less, but I still do quite a bit of it. So that's inserting needles or other substances like liquids into the body's 12 plus meridians. There's actually 14 meridians. Meridians are energy channels. We're trying to trigger an energetic change that the body can heal itself, hopefully. We're trying to promote blood flow. We're going to modulate how the nervous system is perceiving pain and also potentially modifying motor function. We're going to release anti-inflammatory and pain-relieving hormones. These are all established things that acupuncture does. Here is Sophia getting acupuncture. She actually has needles elsewhere in her body as well. Sophia actually was one of my very first house call patients. I was working emergency at the time. I was doing that kind of part-time, just starting my practice. And Sophia came in at 3 in the morning because she was attacked by a coyote in her backyard in the Hollywood Hills. I thought she was dead. She survived. I started going to the home to help the clients. We developed a really good relationship. So I ended up working with Sophia throughout her life. So she was a really good patient. Of course, why was she going outside when there's coyotes? That's the big question. So Sophia in her head has a hand needle. This is probably the best size used for cats. Generally, I don't recommend needles. You don't want to have this long piece of needle hanging out of the skin, because if the needle's like this big and it's sticking into the patient's body and they move, or you hit it with your hand, or something happens and you breathe, it's going to move and cause discomfort. So you really want to use very short needles for cats in general, and for places in the body where you don't have a lot of tissue. I use 2 other different sizes of needles, 13 and 20 millimeter needles as well. They're all very skinny. They're very comfortable to insert. I also do acupuncture electrostimulation. This is really effective for a lot of conditions. You're applying electrical current to acupuncture needles to promote transmission of nerve impulses in a positive and negative direction. It's used for antispasmodic effect on muscles along your spine, especially, stimulation of nerves, promotion of energetic flow across wounds and damaged tissues. Here's a patient of mine. This was Emma, I think. I have a couple of Weimaraner patients that always look very similar. So I'm running electrical current down her spine in a positive to negative direction. On the right side, it's red to black, and then green to black. Left side, blue to black, yellow to black. And that promotes that blood flow. It really is helpful, but you have to have a patient that's very cooperative. They have to be able to lay still, because they get the move and everything pulls out and it's a disaster. Here is actually a really cool case of electrostimulation and acupuncture that helped a cat patient of mine. I've got some cool videos. This is Toast. Toast was found abandoned and brought into the practice where I was working for Euthanasia, but my coworker, Dr. Monica Ravel, who now has her own practice, West Hollywood Animal Hospital, decided to save Toast, and she and I partnered together to help to treat her and get her healthier and feeling good. This is how Toast was first walking when she came to the practice. She could not stand or walk. She had a fractured pelvis. The pelvis healed and it was very narrow, and she was chronically constipated because she couldn't push any poop through. So excuse the people laughing in the background. I can't control everything that happens all the time, but poor little kitty, struggling to get along. This cat, like, yeah, she can't walk well, but she has a life still. She looks happy. She's engaged. So I'm really happy that Dr. Ravel decided that she was going to help her out and try to give her a chance. Here she is, finding a little safe place. Yep, she's determined. So that was like 2011, I think, or so. I did electro and needle acupuncture on Toast. You'll see impulses in the video. So it's a very gentle impulse. You don't want to shock the patient off the table. I've had TENS units placed on my own back, and when they turn it on, it's really jarring. So you have to start super low power. Actually, on Toast, I'm doing something called dispense and disperse, which every impulse is a different power and a different frequency, and it kind of rewires the nervous system to feel better. I also have a needle right above her anus in governing vessel. It's the very last one. I can't remember the name of it. It's right above the anus to try to get that area feeling a little bit better. Kind of like with a kitten, if they're not pooping, you tickle a perineum and you can get them to poop. So there she is getting her treatment. And this is after, I think, about 4 weeks of consistent treatment. We're able to get her walking relatively normal again. Also, beyond just doing needle and electrostimulation, I would do massage and range of motion. So with massage, you're getting lymphatic straining and blood flowing. Range of motion, you're trying to stretch the joint and also the muscles, ligaments, tendons to an appropriate maximum without hurting the animal or worsening their underlying injury. And she really improved, as you can see. She can climb up again. She can use those hind limbs in a mostly functional way. She's really a success story. Go Toast. Other types of treatments with acupuncture needles is moxibustion. That's applying heat to needles or very close to the skin with a moxa stick or resin. It promotes warming and blood flow to arthritic joints, abnormal discs, etc. Here I am applying a moxa stick to needles on an older Cocker Spaniel with back problems. I'm actually kind of on what's called the kidney belt. Bladder 23 is kind of one of the main places I end up working on right in that area to drive heat down into the kidneys. I don't do this that much anymore. Then I have laser, and also there's a lot of like smoke that comes off that irritates your eyes and nose, and even with smokeless moxa, and it kind of smells like marijuana. Granted, it is Southern California and marijuana is everywhere here, for the better. And so I just prefer not to do that. I mostly do laser at this point. I find it's more effective for my needs. Acupuncture is really a great tool that not a lot of people think of. It's injection of liquid like diluted vitamin B12, Adequan, homeopathics, etc. It can help to stimulate your acupuncture point for a longer time as compared to, say, just putting in a needle treatment. So do lots of vitamin B12 acupuncture because B12 is water soluble, and what you don't use, you just pee out. And there's a lot of times when you have, say, inflammatory bowel disease, you're not absorbing vitamin B12 or folate as well. So when you give that injection, it kind of bypasses the digestive tract. It really can help in a lot of different ways, and also just energetically helps the patient quite a bit. And I love my Adequan. Even though this is Adequan K-line, it's safe to use in cats. Cats, you really want to try to minimize the use of non-steroidal anti-inflammatories. So that's where we really want to focus on building joint health. Well, weight reduction a lot of times, and also building joint health. Adequan injections, oral chondroprotectants. Dosaquin is probably my favorite one for cats. And also omega fatty acids. We'll get to that in a little bit. So this is a cocktail I very commonly use, B12 combined with Adequan acupuncture. Laser, the light amplification by the stimulated emission of radiation, something I started using in 2012. I particularly use a cold laser, which is a lower power one. The one that I use is a class 1. It's very, very low power. It doesn't create heat. Sometimes after you use it, there's a little bit of like a tingle. I know because I use it on my body, on my face and stuff. It promotes collagen production. I just don't want to get like Botox and injectables and stuff. Men, I think, look weird when you get that kind of stuff done, and I want to age naturally, but have good skin. So I applied laser directly to body tissues as well. I use it to reduce tissue swelling, promote blood flow and energetic movement. Here's an older Welsh Terrier patient of mine. I had a Welsh Terrier too, so this patient was very close to me. He had bladder cancer and all sorts of pain and spasming along his back, and he would strain so much to urinate that caused all this tightness in the muscles around his back and his pelvis. And so needle and laser helped to kind of smooth out some of that discomfort. And then here's a cat that I worked on the TV show, My Cat from Hell. A friend of Jackson Galaxies was a friend of mine, and she introduced me to him. I had much different hair at that time as well. Look at that ponytail, woo. Anyway, and this is Pump. Pump is a cat that had intervertebral disc disease and arthritis in his little facets. The facets are the small joints that keep the spine in place. And so Pump was uncomfortable and painful to the touch, and also uncomfortable while getting in his litter box. So he would decide to poop and pee elsewhere, at least as far as I recall that the case. And so I did laser treatment down Pump's spine. I did needle acupuncture, and he really significantly improved and became a much more comfortable and less hellish cat. I also love targeted pulsed electromagnetic field therapy. And this is the Assisi loop. The Assisi loop is non-invasive, it's non-pharmaceutical. Some people don't want to give their pets medications. It can actually help to reduce pain and inflammation, and it accelerates healing. The Assisi loop also comes in a really cool thing called the Loop Lounge, which is a collaboration with Sleepy Pod. There are two sides of this air travel appropriate sized container that your dog or cat just climbs in, and you turn on the Assisi loop and it cycles through 15 minutes. And I have patients that like love to go in here. Recently, I started working with an actress named Chloe Grace Moritz. Her dog Ruby had a neck injury after surgery. I got one of these for Chloe, and or technically for Ruby, and Ruby climbs in it and loves it, and she's like super calm. And actually, Assisi makes a really cool thing as well called the calmer canine, which is the loop that is almost like a little halo that attaches to the back. You could use it, it could fit on a cat as well. I guess you could have to modify it a little bit. It can help to reduce anxious behavior, so that frequency can have a lot of health benefits to the body. Supplements, aka nutraceuticals, food-derived substances that have health yielding benefits. Probably the two that I use the most are omega fatty acids. Of course, fish oil derived omega fatty acids, because they're better absorbed by the body than vegetarian sources. Vegetarian sources can help some too, but of course, like a cat is a carnivore, they need that animal derived product. So, and I take fish oil myself. I have for years for psoriasis, for arthritis, for intervertebral disc disease. So it can have that natural anti-inflammatory effect for the joint, for the skin, for the nervous system, especially the skin too. Your skin has a layer of phospholipids on the surface. And if you're eating a fat deficient diet, you might not have enough fat on the surface, and it actually can affect how you can be impermeable to allergens and sometimes have abnormal growth of bacteria or yeast. So it's really important to have that healthy fat layer on the surface. There we go, skin's phospholipid membrane. Nordic Naturals is definitely my to-go product. I also like the standard processed tuna omega oil. I sometimes cycle between taking one I take the tuna omega-3 oil myself right now, but I also take the Nordic Naturals Human, but it's super low flavor, very low odor. Nordic Naturals even checks for radiation, and you want to consider that, like fish living in the ocean, radiation problems, and fish can swim right through it and pick it up. So I really like liquid and capsules. Liquid is super easy to mix into moist food. Capsules, it's basically like 1 capsule per 20 pound of body weight. So it'd be, you could either take that capsule and pop it right down your pet's throat, hide it in their food, or pierce and squeeze into food. Capsules are stable at room temperature. Liquid has to be refrigerated once it's open, or else it goes rancid. All right, my preferred chondroprotectant is something that has glucosamine, chondroitin, maybe MSM, and ideally even other ingredients as well. So those chondroprotectants are the basic building blocks of cartilage, and other ingredients that are added can have a natural anti-inflammatory effect. So this is a great product because it's oral. You can, it's a blister pack. You can crush that tablet. Some dogs will eat it right as a treat. There's a dosaquin for cats. That's a sprinkle powder that you can just open right up. And other ingredients too. Boswellia is a really potent antioxidant. Curcuma longa is the actual plant that's what contains curcumin, which is all derived from the root turmeric, and that can have anti-inflammatory, anti-cancer properties. Green tea extract, alpha lipoic acid, all sorts of good stuff there, benefiting the body. Chinese herbs as well. Like I think I started out prescribing more herbs, but one thing I just kind of mentally have a block with is the fact that these are not like FDA approved. And also there's not studies really showing that they do exactly what we want them to do. And Chinese medicine is also very vague in some ways. So I don't mean to offend anybody if I am in saying that I just don't believe as much in Chinese herbs as I used to, because I just don't know if I 100% trust them as compared to, say, medications that are made by providers that I know that do research on their products to show that they're effective. So anyway, but they're generally safe. As far as I'm aware, Wei Qi booster is something I commonly use in my practice, especially for immune system deficient animals. Wei Qi is the energy that kind of acts as a force field to keep out bad things. And so we want to boost the Wei Qi to boost the immune system. Wei Qi boosters tonifies Qi in blood, helps to boost your Wei Qi and inhibits mutation, but I don't really know how that was proved. So when I put a patient on it, they're not on it for life. They're on it for a certain amount of time to try to get them over the issue in combination with other products as well. It's an oral. What's great is that it comes in these little tea pills, which are really easy to get into patients. Granules are really aromatic and not so great tasting, and encapsulated granules are clear gelatin that contains the granular powder. Patients don't taste it, but if they bite into it, it tastes terrible. So tea pills are probably the best way to go in general, but it's a lower concentration. You have to give more of them. Other herbs that I give docs formula, kind of like a Chinese formula for arthritis. Your arthritis or osteoarthritis, which is a chronic age-related problem, is generally due to deficient kidney yang. Yang. Yang is a heating energy that helps to promote blood flow around the body. So this is an option I would maybe do for somebody if they say had an arthritic dog and they didn't want to do an traditional anti-inflammatory. You might consider a product like this, but again, like not forever using it in combination with other things, trying to make the patient's lifestyle better, weight loss, etc. Euthanasia is part of what I do in my practice. And why is this slide of Jane Lynch here at the mention of euthanasia, even though she is looking a little bit devious? Jane is a long-term client of mine and friend through being her vet. And I've helped her through a lot of animals over the year. These are just 2 of the patients that I've euthanized for her. Olivia is on our right. She's the small dog who at the time only had 1 eye, and then Gentle Ben. Jane and her partner rescue dogs that may otherwise not have homes. You might have seen Arbuckle, the dog. Arbuckle was a very special dog who weighed about 120 pounds when they first found him, maybe 115, and he really needed to lose weight to be about 70 pounds. So she carried him through all that weight loss, and he ultimately succumbed to a horrible tick-borne disease that he had before he even came to her. But anyway, euthanasia in home is so much nicer than in hospital, I feel, in general. The pet is comfortable. They're around family members. The family members can have a party if you want. I've had some people have goodbye parties where friends and family come over and they have drinks and food and whatever. There's of course concern for in-facility euthanasia in the time of COVID, because a lot of times people can't go into the hospitals. I know some hospitals that will allow clients in with mask and social distancing for euthanasia, but a lot of people don't want to not be there to say goodbye or have to say goodbye to their pet over like a Skype call. It's so personal. So I love the fact I can still go to clients' homes to do home euthanasias. I also sometimes transport the pet so a crematory can pick up from my West Hollywood location. I generally try to get a crematory to meet me on site so I can kind of help to take the pet out and everything is just kind of done. But that doesn't always happen depending on the location and the time. So travel health certificates, another thing I do in practice. Microchip scan right away. I kind of had to blur that number out, but travel health certificates can be a little bit challenging. It's like completely not anything that you have to be experienced from a medical perspective. It's all like administrative steps that you have to follow. You have to follow very specific rules. A lot of my patients travel internationally and domestically. They'll go commercially, they'll go privately. And I have to like sometimes very quickly get all the documentation ready. It's really intimidating if the patient is traveling internationally and they're like, I want to leave in 3 days to go to the UK. And you're like, no, not going to happen. We got to make other plans. Actually, UK isn't that bad. Australia is the real challenge. So you need that travel certificate, something that I provide. I get it all filled out for the client. The client then takes it to the USDA to finish the rest. And it's always like, I have nightmares about doing USDA signed travel certificates. It's just like one little dot isn't properly crossed, T isn't crossed, I isn't dotted. And they're like, nope, got to redo it. I also do what I call vet sitting. Here's Sophia with my husband, Phil. She's lounging in our home outside. Her parents moved from Southern California to New York. And so before Sophia could travel, she stayed with us for about 3 weeks. And then we sent her on her way with the caretaker. And it was great to have her. Actually, during the time, we were caretaking for other dogs as well. The white dog and the little dog. Top dog is Biggie. Bottom dog is Rue. Those are dogs owned by Megan Trainer. She's a long-term client as well. And when she would travel, or she now has 4 dogs, actually, not 2. She would travel, or when one of these dogs would get a spay or neuter or dental, I would take them into the hospital and get everything done and then take care of them for the night so they could recover and then return them home. So Biggie and Rue, and then Vader in the middle. He's a very frequent flyer. He's a 3.5-pound teacup Pekingese. Super cute, but a genetic mess. He's a hot mess. I would never recommend getting a Vader. He is expensive. He has expensive health problems. Not even going to go into it. But what's great about vet sitting, I think, well, I get paid for it, A, and then also B, I get to spend time with my patients to get to know them a little bit better beyond their homes. And C, I get to do whatever medically needs to be done. That could be like getting blood, urine, fecal testing, or doing whatever treatments need to be done. So Sophia with chronic kidney disease and inflammatory bowel disease, I needed to give her fluids and medications every day as a subcutaneous treatment. Also, she needed supplements orally. She particularly took a liking to Honest Kitchen, what used to be called ProBloom. Now it's just called goat milk. It's probiotics, digestive enzymes. It's sweet and tasty. I've tasted it myself. And they can drink it, or you could put it right into their mouth. I call it a puppy or a kitty latte. So another palate cleanser slide. Okay, moving into COVID here. So how are dogs and cats communicating these days? Aren't we supposed to be social distancing? Not all dogs get that memo, unfortunately. Here's Francesca, the black pug on the right, getting a little too close to Vader there. Vader wasn't so happy. Actually, Vader was just yawning, but I thought it was a cute picture. So here is what my practice was like pre-COVID. Going to clients' homes, working with them directly. I've worked with Demi Moore and her family for a long time. She's a lovely person and a great dog and person mom. I never ask clients, especially famous clients, for a photo with them in their home, unless there was like something that they're doing. If I get invited to an event, sure, I'll be like, hey, can I get a photo with you? But if I am in their home, I am the vet and they are the client and I'm not a fan. I often don't even acknowledge what they do. But if we start getting to know each other, then I might ask some questions. And I think it's really interesting to hear like what they're doing next. And it's really interesting to see people behind the scenes just being normal people versus how they're represented in the media. You know, sometimes the term fake news is appropriate because I read things about clients. I'm like, no, that's not happening. That's not happening. I know the truth because I know them well. I'm in their house with them. But pre-COVID, I was very comfortable spending time with people. No need to physically distance. No need to wear PPE. I could work with them right in their homes, hold their dogs on my lap, not have them be afraid. Like, what if I have COVID? I'm going to sneeze or cough on their dog and get it in the eyes or nose. Could the dog become affected? Could the cat become infected? So no need to wear those rubber gloves or PPE at the time, but things have changed. So post-COVID, of course, everybody's socially distancing. Our pets need to be socially distancing as well. Here, my patient Finn isn't able to see his dog friends. He's looking out the window, wondering when this is all going to be over. Now with COVID, I wear my mask all the time. It's really important to have your PPE on. I've gone through different levels of wearing PPE too. Sometimes more in the beginning. Some now I feel more comfortable and people more comfortable. I know really the mask is the more crucial thing. And of course I wash my hands and hand sanitize all the time. I even wear my PPE when I go into the grocery store. Of course, that's super important. Gloves, I think in the grocery store, yes, because you just don't know. I mean, granted, I feel like I see them cleaning down the shopping carts and everything, but at the same time, who knows like who coughs and sneezes where if they're not wearing a mask. Post-COVID, I see patients in a variety of places. I see patients outside. This was the very special dog that I mentioned before. I had to be there for the surgery. This is Lukey. When COVID hit LA, his family's of means, and they decided to move out of LA to a horse ranch, a 150-acre horse ranch in Los Olivos, which is north of Santa Barbara. So Phil and I would drive up to see Lukey twice or more a week to do an overall assessment and do whatever needed to be done. He needed epigen injections to help to promote his red blood cell production. He needed frequent blood testing. He needed B12 injections. He needed fluids eventually for kidney disease. So whatever it took, I went up there. But it's lovely to kind of get up there and be in this wide open space. So especially initially with COVID, LA became like a clean place again. The air quality was better. It rained a bunch and washed all the filth down. But it was really nice to get away to an area like this just to kind of breathe some different fresh air. What was kind of cool was when the family moved to this place, they had a hiking trail on their property, like 3 miles. So we would see the patient and then do a walk before driving 2 hours back to LA. And I got to see all sorts of cool creatures up close and personal. And normally when I'm on a hiking trail and I see a snake, I'm like very concerned because usually it's a rattler. But this is a gopher snake, which has a pattern that looks kind of like many rattlers, but the head is very narrow. I wouldn't want to be bit by the snake, but at least I know that it's not poisonous. And I just kind of stayed out of the way respectfully. And this snake like really wasn't even moving. But on this hike, I've seen tarantula, wild boar, let's see, red velvet ants, really cool lizards, all sorts of things. Post-COVID, of course, I'm wearing my PPE. I sometimes see my patients outside on their front porches. Here we are at Norbert's place. This is like really early COVID. I'm wearing eye shields, a different face mask than I wear now. When that's what I can't remember what that type is called, but it's like a heavy duty face mask for painting and really working in like construction. But we'd see Norbert outside because mom didn't want us to come inside. Now mom actually like comes out and sees us, not stands behind the glass. Post-COVID, I see patients in driveways as well, kind of whatever it takes. It's really easy to work in a driveway unless like there's a lot of distraction as to what's going on in the area around the driveway, and then it makes it a little challenging. I have had times I'm like working in the client's front driveway, and then neighbors walk up, oh, what's going on? And they want to ask me that question. I'm like, I don't think you're my client or my patient, so please just go away so I can focus on my patient. Thank you very much. Post-COVID, I work in garages as well. Here I am with my patient Dugan, and kind of interestingly, right before I went to see this house call, Dugan's an old pug. He's got osteoarthritis in his hips. I see him every 2 to 4 weeks for laser treatment, needle treatment, Adequate injection. And I got a call from Fox that they wanted to talk to vet about COVID and pets. And so like half an hour later, I was going to this appointment. They went and met me at the appointment, filmed in this garage talking about the concern for COVID and pets. Because initially there really wasn't a concern that pets could get it at all. And then we had some dogs in Hong Kong get it, and another place in Europe. Then we had lions in the Bronx Zoo get it, and we had a pug that was infected in North Carolina. And not just like exposed, but actually infected, showing clinical signs, testing positive. So it certainly is an evolving thing that we'll get to in a little bit in terms of concern for pets. I still, of course, now go to clients' homes. This is my newer mask. It covers everything up. I wash it every day. Mutato actually is a music production company owned by my client, Mark Mothersbaugh, the lead singer of Devo. So they gave us these really cool masks that I wear. So I'm really happy that I can still work in clients' homes. Sometimes patients come to see me. This is Rossi and Maggie, Maggie and Rossi on Instagram. They are incredible, well-trained dogs, and their mom's an amazing dog trainer, Nicole Ellis. So they are in my garage seeing me. Post-COVID, sometimes I Skype. Demi kind of fled for Idaho for a couple months. She's still there with all her dogs, and her daughters kind of rotate in and out of there. This is Demi and Rumor. This actually was a project that I worked on called the Elevate Science's Pets in Need project, and I interviewed them about their relationship with pets, and they gave us a shout out for the cause. But I Skype with her sometimes because I've seen the pets frequently enough, and as a problem, she can like hold them up and show me what she needs to show me, and I can diagnose over there and get medications or advise on medications that she currently has. I'm just really grateful that I can still practice like I was before post-COVID, because now clients aren't having any FaceTime with their veterinarians. And it's a little bit challenging because I think part of being a vet, most people think like, I want to be a vet because I love animals. I don't like people, I like animals. To be an effective care provider in any medical practice, you have to be an effective communicator. And that oftentimes involves communicating in person. So you have to be able to have that relationship so that they trust you, so that you can recommend treatments and they will trust your recommendations for diagnostic testing, for treatments, et cetera. So I'm really grateful that my practice hasn't changed that much. And it's probably gotten busier in some sense because more people are getting animals. Clients that maybe didn't have a pet are feeling like they have more time, so they can dedicate the time to training and doing whatever needs to be done. So I'm really grateful that I have this type of practice at this point. This is what I call my last veterinary job beyond like public speaking and product development and working with companies and things like that. I will never work in a practice in a conventional sense again, especially now during and after COVID. So now is probably not the time to fall in love during the COVID pandemic because everybody's wearing their mask. So you never know what lurks beneath. At the same time, being in Southern California, it's so sunny all the time. Of course, I wear sunblock every day on my face and wear hats when I'm going to be outside doing anything sunny. I wonder if there's going to be like a beneficial effect that people are getting less cancer on their face because they're wearing a mask and the mask is blocking the sun. So of course, there are some good things with wearing a mask, and like some of my clients can go out and not be recognized as much. So I do have concerns for COVID in my feline patients. It is a zoonotic disease. Technically, it's a reverse zoonosis because bats were the originator of the disease. It went to people, and then people are putting it back into animals, into cats. Cats have a more appropriate receptor than dogs do for COVID, so they're more prone to becoming infected and showing clinical signs. So far, no cats have died, but if say a cat is very old, very sick, has complications from other disease conditions, say they have cancer and are on immunosuppressive treatment, or they're horribly obese and they have bad heart disease and bad respiratory function and have feline allergic bronchitis or feline asthma, there's always potential that it could kill them, but it hasn't thus far that I'm aware of. I put in here like your cat could die because you just never know. If you do have those pre-existing conditions, you're much more prone to getting sicker as a person and likely as an animal. We just don't know enough of that in animals quite yet. So if you think you are exposed, if you think you have influenza, if you think you have COVID, if you think you have other SARS, if you think you have swine flu, social distance from your pet, cough into your elbow, hand sanitize, wash your bedding, get like positive pressure in your room so that the air is blowing in instead of out. Be careful. Here's Sophia again, getting acupuncture. Is there same species transmission? That has not been proven thus far. I can't say 100% no, it couldn't happen, but so far cats can't give it to cats or to other species, but let's just be very cautious. Probably the best resource I feel like it's not updated as much anymore because everything is kind of quieted down in terms of COVID and animals, is through the AVMA. Maybe screenshot this if you're interested, or maybe Basepaws could take that information, put it up. It's a really like well put together, frequently asked questions that talks about some of the history of COVID in pets as well, as I mentioned before. So definitely check that site out. Also the World Small Animal Veterinary Association, WASAVA. Okay, COVID and cats. A challenge that I may have is, okay, I now in my practice, the client may want me to see the patient outside. So if we have to work outside, working outside with cats is a challenge because what if that cat gets away? And cats are just sometimes harder to work with when you're trying to restrain them to do an exam or to do a blood draw or something like that. And so working outside just opens that whole box of worms in case the cat gets away, and then you're kind of responsible for finding the cat. Also, that safe outdoor area is good to reduce the potential, like you're not going to breathe all the same air as the person, but yes, the cat can go missing. This is just a little kitten that I color marked because there was a whole litter of kittens in a client's backyard in Beverly Hills. And so we needed to mark them so we knew who was who, but like the next day, the mom licked off all the water soluble color. All right, COVID. Can we test patients, both cats and dogs? Yes, we can. IDEXX offers a test. It's not just a let's just test because we're curious. We have to actually be concerned with the patient. It only should be done in animals after considering other tests have been done. For example, IDEXX offers a canine and feline respiratory disease panel, which is PCR testing that tests for common respiratory issues like Bordetella, herpes virus, rhinotracheitis virus. So you have to rule out other problems before we can say, all right, let's start to look for COVID. So it's kind of, you must do this other test first before they will do the SARS COVID-19 test on your pet and your cat. It's not recommended for patients that aren't showing clinical signs. Testing should be limited to animals with clinical signs consistent with COVID, and not just like they ain't doing right, or they're strongly suspected to have COVID-19 exposure. I have a client actually who shipped their dog to training and doesn't want the dog back in the house until the dog has tested negative, because she's so concerned for her older husband who is immunosuppressed that the dog might bring in something. So we might be testing that dog before that dog goes back into the household. The process of getting this test is not exactly pleasant. I actually haven't had a COVID test myself because I don't have concern for exposure, and I'm highly aware of social distancing and PPE measures. And I just don't feel like it's worth getting tested if I don't really think I'm infected. And I haven't been exposed to somebody who has at this point, but it's like in people, it's not a comfortable thing. So in dogs and cats, you're gonna swab the back of the throat. That's the deep pharyngeal swab. You wanna get some organic material on there, a little bit of mucus, and then possibly conjunctival swab, where you're swabbing the inside of the eyelid. Generally, it's better to do on lower because they have the nictitating membrane or the third eyelid that can pop up to protect. So you can just swab in that area to get enough material. That's actually how you do other PCR testing, like the respiratory disease panels. If the patient is cooperative, you also could swab the nasal cavity. I can't imagine shoving a swab of a cat's nose. That's not going to be part of my plan anytime soon. And then additionally, the turnaround time takes about 1 to 4 days. In case there's a positive result, they have to do another test to reconfirm it, just to make sure they give the right information. And if you want to learn more about this, check out IDEX. You can just get this information yourself online. So this is my final palate cleansing slide before I move to my conclusion and to questions and answers. So I think it's hilarious when I see misspelled signs. This is a nail salon down the street where I sometimes get pedicures, because it's really important to keep your feet clean and cut all like the bad stuff off your toes. Hopefully other people are doing the same thing. So in reading this, I love how like misspelling 100% sanitary cleanness is our signature instead of cleanliness is our signature. So this just gives me hours and hours of amusement. So thanks very much for having me. Hopefully I kind of showed you that there's something different out there, you veterinarians, or maybe you future veterinarians or people in support staff, that you can kind of do whatever you want in veterinary practice. Here's my business, California Pet Acupuncture and Wellness, my website. And if you want to email me, patrickmahaneyvet.com. Now let's move into questions.
That's fantastic, Dr. Mahaney. Thank you so much. I'm going to encourage you guys to screenshot that information and reach out to Dr. Patrick. We are out of time on this session, unfortunately. This is amazing information. People are interested in just sort of knowing more about what you're doing. So if we didn't get a chance to your questions, please reach out directly to Dr. Mahaney. You guys, thank you so much. Thanks for what you're doing. I mean, integrating Western and Eastern, getting in the homes. We know you're able to address so many other issues, and then you're out here educating us on the benefits and to help all of these amazing cat owners know that they can do better by their cats by giving them the opportunity to have an in-home visit. So better patient care, it's what we're all here for. We'll be sure to have you on again. We'll get you on another Facebook Live soon, Instagram Live. We'll see you soon.
Coffee and cats. Speaking of coffee, I'll have some now.
That's right. That's what we do best. So Dr. Mahaney, thank you again. We look forward to talking to you very soon.
Thanks.
Bye.